Chances are you've heard of bipolar disorder, and given that it affects roughly 4.4% of the population, you might even know someone who has it or have it yourself. Despite its prevalence, bipolar disorder is often shrouded in harmful misconceptions and stigma. In this video, we're going to set the record straight on what we know and what we don't about this condition. So what exactly is bipolar disorder? It's a mental health condition that causes significant shifts in one's mood and behavior, resulting in fluctuations between highs, known as manic or hypomanic episodes, and lows, or depressive episodes. While we can't say when in our evolutionary history bipolar disorder first emerged, the first known references to a mental health condition involving extreme moods dates back to ancient Greek physicians and philosophers, including Hippocrates. At the time, these thought leaders believed mania and depression, also known as melancholia, to be caused by the presence of yellow or black bile in the body. Not much changed in our collective understanding of this condition over the next 2,000 years. In the 1850s, two French psychologists, Jean-Pierre Faure and Jules Baillarget, also described a mental health condition that involved cycling between mania and depression, with random stretches of time between the two. A few decades later, German psychiatrist Emil Kraepelin coined the term manic depressive insanity. Talk about a stigmatizing term, which described episodes of mania and depression, as well as periods of confusion and delusion. Then in 1952 came the Diagnostic and Statistical Manual of Mental Disorders, otherwise known as the DSM, which is what psychologists use to diagnose and treat mental health conditions. The first edition included manic depression, categorized as a psychotic disorder. It wasn't until the third edition, or the DSM-3, published in 1980, that we saw a diagnosis of bipolar disorder and mood episodes that was generally consistent with how we talk about bipolar disorder today. We've made huge strides in normalizing mental illness over the years, especially more common conditions like depression and anxiety. But bipolar disorder remains particularly stigmatized thanks to exaggerated, one-dimensional portrayals in pop culture and the lack of understanding about the nuances of living with bipolar disorder. But the onus shouldn't be on patients to educate the world about their diagnosis. For starters, bipolar disorder is a complex, multifaceted condition that can manifest differently in different people. We all experience shifts in our mood and behavior, but bipolar disorder causes significant, unpredictable shifts that can last for days, weeks, or even months. These shifts are referred to as mood episodes, and there are a few different types. Manic episodes are often described as feeling euphoric with lots of energy and little need for sleep. In a manic episode, someone might feel unusually overconfident, jumpy, and impulsive, with their thoughts and speech moving at a rapid pace. But mania doesn't always present as extreme elation. Irritability and anger can also be symptoms. Hypomania is a less intense version of mania, causing drastic increases in mood, energy, libido, productivity, and self-esteem, though it is not as disruptive as a manic episode. Depressive episodes usually resemble depression, with feelings of sadness and hopelessness, decreased energy, trouble concentrating, and suicidal thoughts. Hallucinations and delusions can also sometimes show up in either manic or depressive episodes, which likely adds to the stigma of bipolar disorder. Finally, there are mixed episodes, which involve symptoms of both mania and depression at the same time. Bipolar disorder isn't a one-size-fits-all diagnosis. In fact, the National Institute of Mental Health outlines 4 different types of bipolar disorder, depending on the intensity, duration, and combination of symptoms. Bipolar I disorder typically involves manic episodes as well as depressive or mixed episodes, while bipolar II disorder involves hypomanic episodes and depressive episodes. Cyclothymic disorder is also under the bipolar umbrella. People who live with this form of the condition have both depressive and hypomanic symptoms on and off, but these symptoms don't justify a mood episode. Finally, there is other specified and unspecified bipolar and related disorders, which describe people who experience symptoms of bipolar disorder but don't fit neatly into the other types. Of course, these categories are merely a diagnostic framework and don't encapsulate all of the nuances in the individual experiences of those who live with bipolar disorder. While we don't know exactly what causes bipolar disorder, researchers think that genetics and brain structure likely play a role in developing it. Treatment for bipolar disorder typically consists of a combination of medication, therapy, and lifestyle changes. Things like sleep, nutrition, activity, and social support can all help someone manage their bipolar disorder. If you're experiencing intense highs and lows and think that it might be bipolar disorder, you don't need to live with it in silence. Talk to your primary care provider or a therapist or counselor if you have access to one. And if something in this video resonated with you, that might be a helpful thing to mention too. Remember, bipolar disorder doesn't define or limit a person. Hopefully, the more we talk about it and understand it, the less stigmatized this disorder will be.